Thank you. Thank you so much for having me on. Excited
And
to answer all these questions.
yeah, we have a lot of good questions today. So, the topic today is why most doctors get women's hormones completely wrong. And I'm going to read a little bit about your background before we get started, too. So, Dr. Kristi Harter is a renowned naturopathic physician and hormone expert with over 2 decades of experience in helping women and men achieve lasting balance within. Her approach blends the precision of science with the intelligence of the body, creating truly transformative results. Her former practice in Santa Barbara earned her a reputation as the go-to voice in women's wellness, drawing a clientele that includes high-profile entrepreneurs, athletes, creatives, and mothers navigating modern stress and hormonal shifts. Now she brings that same high-touch care to a global audience. So, welcome, Kristi. We're very excited to have you today.
Thank you. Thank you.
So, the first question we have is something you and I were already kind of discussing this week, and you were telling me all about it. And that is your OBGYN missing the root cause of your symptoms? Because we were talking about how most OBs actually get less than 4 hours of hormone training in medical school. So, let's hear your thoughts on that.
Yeah. And this is a hard topic because women experience hormonal shifts all through the month. I mean, especially if you're still menstruating, they change all month long. And if you don't have someone on your supportive team that knows about hormones and what they're supposed to do and what they're not supposed to do, then it's really, really difficult to diagnose and treat any kind of hormonal imbalance. And, OBGYNs, I've talked to a lot of them, and they just they don't get the education in school that they need in order to treat any kind of hormonal imbalances. And so their go-to most often is to use an oral birth control pill. And that oftentimes will mask symptoms and not actually treat the cause of why you're having a hormonal imbalance. Now, there are some great, great, great OBGYNs that have gone on to do continuing education in hormones. And, that's the kind of person that you want to seek out because that extra training gives them the knowledge and the experience in order to actually treat someone who has any kind of hormone shifts. And it happens all the time. So, um, OBs are not. They're not really in the business of correcting hormonal imbalances unless they've made that their expertise.
Mhm. Yeah, and I mean, that's so interesting because I think most people, and especially most women, their go-to, when they first start noticing things hormonally or they reach a certain age or they're going through something, is they reach out to OBs first, or they think they are the gold standard kind of for hormones. And yeah, and surprisingly, even though they specialize in women's health, that is a key component that they are really missing.
Absolutely. And, that's what we have all been led to believe is that they are the experts, the one to go to. But the truth is they just don't get the education for it.
Yeah, so it's really if they just take it upon their own afterwards, and how do you find that and how do you really know that? So that's something for all of our listeners to be aware of.
Absolutely. Well, if you think that you have a hormonal imbalance, definitely look for a provider that has done the extra education. And usually, if you call someone's office or just look on their website, it'll be pretty clear whether or not they've had the extra education in hormone health because it's super important. And,
Mhm.
if their first idea is to put you on birth control, then they're not the ones that are going to help you to really treat the cause and really shift the imbalance in your hormones.
Yeah, that's definitely a red flag to look out for. So
For sure.
I have kind of a tricky question for you. So if a woman walks into your clinic saying, "I feel off," where do you start with that?
That's a big question because it can be a lot of things. But, my first visit is an hour long, and I ask questions that no one else has probably ever asked these patients because I ask all about stress and the environment and potential, environmental exposure to things. But the answer is usually in somewhere in either the digestive tract or in their stress resilience or in their insulin and blood sugar control, because those are kind of the things that throw off the endocrine system the most, because cortisol and insulin are those are the master hormones, and those are the ones that kind of regulate everything downstream, including the sex hormones, the important ones that we think are, probably making us not feel good, the estrogen, the progesterone, and the testosterone. Those aren't the main hormones to look at. And so if you're really stressed, all of your hormones are going to be off. If your pancreas is making too much or too little insulin, then everything else is going to be off as well. But we have to always look at the digestion, because digestion, it's like where everything starts. Like if you're not absorbing your nutrients, if you're not eating the right foods that allow you to have the right nutrients, then your whole entire endocrine system, your nervous system, everything is going to be out of balance as well. So we have to kind of look at the full picture of everything that's going on, all of the symptoms, and kind of picking apart where the ultimate cause is. And a lot of times with hormonal imbalance, it's not about the hormones. It's not about how much, estrogen or progesterone your body's making. A lot of times it's about the fact that you're eating the wrong foods that are causing a ton of inflammation, and your body's not getting the triggers in order to produce and to metabolize the hormones correctly. And that's where a lot of people just kind of get into this stuck place, is they think, oh, my hormones are out of balance. Let me take something that's going to balance my hormones. But you're not treating the initial cause. You're not treating the trigger. And it makes it, quite difficult to be able to treat the imbalance in hormones when you don't have everything else in balance. And it's a little bit longer process, but it tends to get lasting results, because then you've actually looked at where the real imbalance starts and you've started there, and everything else will fall into place sooner and more effectively and more efficiently if you start with first things first.
Right. No, I think that's so powerful. And that's something I think a lot of people aren't aware of too, right? When they think of hormone balancing, they think of taking hormones, and that's where you start. But it really starts a lot further, and it has to do with the whole body. And so, I mean, that approach, a lot of times you might not even have to take any hormones, or you can stimulate your body's own healing mechanisms that way.
Absolutely.
So,
Well, and I always start with food. When I decided to get my master's in nutrition, it wasn't until I was almost done with my doctorate. And I realized that I did not have the expertise in order to look at somebody's plate or look at somebody's food journal and know if, you know, potentially their food was causing an issue. And I start with food with everyone, because finding the foods that work for your body, it's going to be like you have to eat. So it's going to be one of the easiest things to do. Once you find your foods, then your digestion gets better. Then, like everything else gets better, because you know what food to eat. You know what's going to support your digestion the best. And if we start there, that kind of basic foundational thing that we have to do every day to nourish ourselves, then everything gets a little bit easier. And starting with the hormones first just doesn't work, because you're not making sure that the rest of the body is optimal, and you just don't get the results that you want if you don't start at the beginning.
mhm. Right. And yeah, I mean, just with all the studying too of foods and the microbiome and how deeply it's interconnected to every single process in the body, and hormones and how you metabolize and excrete hormones and all these different processes. So Yeah, something simple can have profound effects that way for sure.
Absolutely. It's it's the elimination diet, I would say, is probably the one thing that gets results better than anything in my practice, is helping people find the foods that really make a difference.
And can you explain the elimination diet to our listeners quickly, too, for those who
Absolutely.
don't quite understand it?
So you can do it one of two ways. And I give the option for my patients. So either you can start with a food sensitivity test where it's a blood draw, and uh, it's basically checking for an immune response to the proteins in food. So you can start there and then, really have a targeted approach to the foods that your body is reacting to. And you take those foods out of your diet for 2 weeks and see how you feel. And then you start adding things back in. You do it, kind of a systematic way where you add a food in once every third day, and you see how you feel. Do you have fatigue? Do you have digestive issues? Do you break out in a rash? Does your vision get blurry? Like, there are 100 things that could happen as a result of eating something that your body isn't uh, is reacting to. And you just kind of go through all of the foods and you see, what's what. You see how your body reacts, and what makes you feel well and what doesn't. And then you'll always know. So if there's something that gives you a little bit of a reaction, you eat cheese and your pinky toe tingles. And that's the only reaction that you have. But you have this cheese that you really, really love, and you want to eat the cheese once a month. Then that becomes your choice. But now you know what is
Mhm.
causing the tingling in your pinky toe. And you'll never not know. But you can make that choice, that really educated, knowledgeable choice, once you know what foods are doing for you or not so much for you. And then if you don't do the food sensitivity test, there, there's a lot of different elimination diets, but the elimination diet that I usually use with people is an anti-inflammatory diet, or it's also called the autoimmune protocol, where you eliminate whole big groups of things just from your diet. Now, it works great because you're eliminating a lot of things that are known to be allergenic, but it doesn't work specifically for the foods that your body has reacted to. So, say you were allergic to avocado or reactive to avocado, that's not necessarily going to be eliminated in the autoimmune protocol or the anti-inflammatory protocol. So, it's a little bit less personalized, but it also works really great. And you're going to do basically the same process. You're going to eliminate the foods for 2 to 3 weeks, and then you're going to start adding them in really systematically, and journaling how you reacted, because if you don't, at some point in your life you will forget how you
Mhm.
reacted. And if you can have something written down that you can go back to, it's really nice to kind of just view that every once in a while and just remember what you've reacted to and what you haven't. So, but it gets great results. I have been using it my entire career, and I think that it probably moves the mark better and faster than anything else that I do.
Yeah, and I think it's so great, and I think it's such a great experience for people to start paying attention to their body. Like, so many people, are so disconnected, and having that practice, which is, it can be a big undertaking, but it's worth it, and it connects you. It brings that connection back too. So just that alone of starting to pay attention to things that you were too busy to, especially like if you're working or your schedule's too crazy, it ties that all back in.
Absolutely. And, when you're putting things back in really systematically, it's like a science experiment. I mean, you're going to know because everything else is going to be eliminated, and you're putting one food in, and it sometimes the effects will be subtle, but sometimes it'll be a big side effect, and you'll know. exactly what the food is doing for you or not for you. And it is, you're exactly right. It's a good connection, a good touchstone to just see what your food's doing for you.
Yeah. No, thanks for the explanation. I'm going to jump to our next question too, which is what is your favorite functional health test for women?
Hands down, the Dutch test. It is, I love it. I love it more than any test. There are so many different analytes that they test during it's a saliva and a urine collection. So it's a hormonal test. If someone is menstruating, then we do it on day 21 of the cycle. And if someone's not menstruating, if they're on hormones or they're in perimenopause and they've got irregular cycles, then we'll just kind of pick a day when they can do it. It checks your cortisol throughout the day, so 4 times throughout the day, which is great for us to get a good picture of how your cortisol is being produced and released in the system. It checks all of your hormones, your estrogen, your progesterone, your testosterone, but it also checks the precursors, pregnenolone and DHEA. And it also checks all of the metabolites. So knowing how your estrogen is metabolizing is hugely important, especially for anybody that has, if you're over 35, you're probably not making as much progesterone as you did in the past. And if you're not metabolizing your estrogen in a way that supports it kind of getting out of your system fast, then you're going to have more estrogen dominant symptoms. Even if your progesterone is okay, the way that you're metabolizing your estrogen can really affect how you're feeling. And so if we know those estrogen metabolites, it gives us a good leg up on what to do therapeutically to treat. And then um, the test also does this really cool organic acid testing. So it tests B vitamin markers, it checks some neurotransmitters, it checks your glutathione markers. So it gives us so much information in just that one test. Every single woman should do at least one Dutch test to know how you metabolize estrogen, to know where your numbers are at, and to know your cortisol. I mean, I actually think that women should do it at least every year, but at least once because it just gives us so much good information that you're not going to get anywhere else. And I love it. I've done the laboratory that does the Dutch test. They have all of this great education for practitioners, and I've done all of their education because I just want to soak up all of the information about that test because it's just so good and gives us so much good information that I think everybody should do it.
Right. And for those who are listening, and if you go to your primary care physician or something covered under insurance, typically you just get the basic blood markers. And so I think that's really the key difference here is, you think you're getting hormone testing there and it's relevant to some degree, but you don't get all that extra information too.
That's correct. And if they're doing a blood test not on a particular day of your cycle, then you're not really getting the accurate information that we want to. So if you if you talk your PCP into giving you a blood
Right,
test for your
right.
hormones, because a lot of times they will be like,
Yep.
no, that hormones fluctuate, and it doesn't do us any good to test them. I hear that all the time from my patients. It's not true. Testing your hormones in the blood is actually a great thing. You just have to know when to do it. So if we're looking for, progesterone, it peaks on day 21 of your cycle. If we're looking for, the ovulatory hormones, estrogen and testosterone, then we have to do it during ovulation. So around, days 14, 12 to 14, depending on when you ovulate. But if you're not doing it on those days, then your provider's right. It's not going to give you great information. But your those markers are available on the Dutch test, and they give us so much more than just a blood test would.
Right. And that gives you information on how to support those pathways too. So you can see them, you know what's off, and then you can really go into what is causing this and kind of targeting it that way.
Exactly. Because a lot of women, like I was saying, if your progesterone is gradually decreasing like it does after
Hmm.
we're about 35. If it's decreasing, but your estrogen is either increasing or you're metabolizing it into a pathway that actually makes it stronger, then you're going to feel much worse. And if we don't know that that's happening, then I won't know how to support you in a way that's going to make you feel better.
Right. And so I'm gonna transition a little bit into the next question because you were really explaining this to me the other day too of kind of what's going on with hormonal birth control and how it's getting prescribed. So what do you wish every woman knew before going on hormonal birth control?
Whew, this is a tough one because I have a lot of women that come into me either on birth control or hormonal birth control or wanting some kind of birth control. And if you want it solely for contraception, there are other ways to do it. If you have any kind of menstrual irregularities or difficulties, the pill, it might help. It might help you feel better. But the hormones in the pill are not the hormones that our body makes. And that's the one thing that all women should know before they go on oral birth control is they're not it's a synthetic hormone that your body doesn't necessarily recognize. Now, the the synthetic hormones will fit into our estrogen and progesterone receptor sites, and they block those receptor sites. And the blocking of the receptor sites can sometimes make you feel better and can mask some of the things that are going on, but it's not going to cure the problem. And if you're a woman that would like to try to conceive, to start a family, and you're on hormonal birth control because of an imbalance in your cycle, because maybe your cycles were irregular, maybe you are bleeding a ton or having a ton of clots, or maybe you have migraines before every period or super bad PMS before your period or whatever it is. If you start taking the birth control, you might feel better. You might feel worse too, because that happens a lot, especially for women who are, over 35, because we're already not making as much hormone. But it's not going to fix the imbalance. And in order to fix the imbalance, you have to be off of those hormonal birth controls. We have to figure out why you have the imbalance, correct that, and then you have a much better chance of conception so that you are actually correcting the imbalance instead of just masking it and taking something that's going to potentially make the symptoms go away.
Mhm. And then, I mean, what is your experience with women getting off of birth control, right? Like they've been on it for a while and then trying to get off, sometimes the symptoms get so much worse too, right? Or they have to go through like a rebalancing period. So thinking about those, all of those things before starting it, I think is incredibly
Absolutely.
important. Yeah.
Absolutely. Going off birth control can be easy, but for those who have had difficulties with menstruation or any kind of the things that
Hmm.
I was just talking about, it can be more difficult, but I always do something first. So I will generally check cortisol and throughout the day and see how the cortisol is, rebalance that. I will generally make sure that the patient has some kind of knowledge of what their foods are doing to them, so either doing an elimination diet or some kind of testing to make sure that their diet is supporting their hormone production, and we've got that kind of under control. Because if we take that person off of birth control in order to get a test that would be accurate, then they're going to have a waiting period. And in that waiting
Hmm.
period, they have the possibility of getting symptoms back if their symptoms were resolved with a birth control. So there are all these things that I put into place to make sure that the person is feeling as well as possible through that transition time so that we can get the accurate results and we can actually rebalance the hormones in a way that works with their body.
Right. Yeah. I mean, all of that is so important. And I guess I wish back in the day that I knew all of that when I was, I think, 20, 30 years I know I'm really aging myself now, but yeah, there just wasn't that information out there. And I mean, still, there's a big disconnect. And I see that in a lot of patients too. So it's so important for them to be aware of that. Um,
Absolutely. And if women are looking to help their hormone issues and they're looking for contraception, the go-to is an oral birth control. And it's easy and it's a quick fix and it's easy
mhm.
to prescribe. So, if a practitioner doesn't have the knowledge to do all of the rebalancing, then the first thing that they're going to go to is a oral birth control.
Right, right. Okay, next question. This one's very interesting too. Are painful sex, vaginal dryness, and numbness just part of being older, or can you address these symptoms?
It's not just a symptom. Now, when the estrogen drops, your estrogen is a moisturizer. I mean, it moisturizes all of your joints. That's why women, your estrogen starts to drop and all of a sudden you have joint pain that you've never had in your life. And you're getting, creaks and aches and pains. And it's because you don't have as much estrogen to lubricate your joints and also your vaginal tissue. So yes, it can be an issue, but there are so many things that we can do that will help with the vaginal dryness and the lubrication issues. Now, you can take estrogen, but there's a lot of things that we can do that will help. And I mean, honestly, the number one thing that I see that women are not doing that they need to be doing is just drinking enough water because it
Mm.
really does make a huge, huge difference in all of your joints and all, your vaginal tissue, all of your mucous membranes needs that moisture. And if you're not hydrated, that's going to be, it's going to be much, much worse. But there are really simple creams and topicals and things that we can do that help all of the vaginal moisture and all of the things. There are herbs that help with that. I mean, there's so many things that we can do that aren't hormonal and so many things that we can do to prevent that from happening because once you get of a certain age and you're not making your estrogen and you're not having the vaginal moisture, then you don't, you stop wanting to have intercourse. And it's a whole nother trick because most men, although testosterone does decrease as they age too, and libido does change, um, it tends to happen later for men than it does for women. And that can be a real disconnect in relationships and make it really difficult to know what to do. There are
Mhm.
some bioidentical creams that are pretty commercially available that most OBGYNs do know about. And if you take something vaginally that's an estrogen and you're not taking a progesterone, you are still getting some systemic absorption of that estrogen. So just beware if you're on a vaginal estrogen and you haven't had your numbers checked for your estrogen and your progesterone, you have to make sure those are both in balance too if you're taking one and not the other. So that was a big answer to your question. But I think it warrants, some introspection because most women are just being given the estriol for their vaginal tissue and not there's no consideration for progesterone or the other estrogens as well. And there's a lot of opportunity for doing, different things and also doing, some things that will work more efficiently than just that basic cream.
Right. And just knowing that there's things out there, you don't have to settle and say, this is happening. There's nothing I can do. But there's so many different routes to go with it.
Absolutely.
Mhm.
100%. But testing is key because you have to know whether or not you're still making some estrogen, you're not making estrogen, you're not making any progesterone. You still have to know what you're making before you start trying to treat anything. Because if you try to treat without knowing, then you're kind of just throwing darts in the air.
Mhm. Right, right. So we go back to testing on that too, and the right type of testing to get the most
Correct.
information.
Correct.
So, and kind of another question along those lines is like, what if your anxiety is hormonal and not mental? So, how do you discuss this of where mental health lies and hormonal imbalances and how they are interconnected too?
Yeah, this is a big one. And I have a whole like hour lecture on this, so I could talk a long time about this. But the bottom line is there is hormonal anxiety when, progesterone's the peacekeeper. And when you don't have a lot of progesterone, you're going to be more anxious. It, it just is. Your nervous system does not react the same way. So there are a lot of physiological reasons for anxiety, a lot of things that happen on a cellular level to cause anxiety. One of those being the progesterone, like I just said. Another is cortisol. If your cortisol is too high or too low, then when you get, when you have any stress in your life, you won't be able to handle it. You'll get into overwhelm and your nervous system will get too excited and you'll have anxiety. So those two things alone can cause huge issues with anxiety. And then, there are all of the other things, the neurotransmitters, like I was talking about with the Dutch test. Those are checked because those also change when your hormones change and your serotonin receptors in your brain get lower, your dopamine receptors change. And so all of those things can change because of hormones, but they can also change for other reasons like stress and your cortisol, not either not producing enough or too little cortisol or producing too much of it. So when anybody says that they have anxiety as one of their main conditions, I always check the physiological because anxiety can be very in your head, but it's that's typically not the cause. It's not just because you're an anxious person. There's 99.9% of the time there's something physiological, something physical that's going on cellularly that's causing that to happen.
Yeah, and I think so many people go to the route of, like, is my serotonin off? Is my dopamine off? Or focusing on just like key neurotransmitters versus looking at the entire picture of how hormones affect those key neurotransmitters too, right? Like, where are we going with this? Of whether it's the microbiome, whether it's neurotransmitters, all these different things, rather than looking at hormones and how all of those hormones really affect anxiety and mental health in general.
Exactly. Yeah. Well, that's the part of I mean, like I said, I love the whole Dutch test, but I really love it because of the organic acid markers, because that tells us so much more information than, just a hormone panel. Because then we can have a key into what the neurotransmitters are doing too, so that we know, if those need some support as well.
Mhm. So, kind of moving on to my next question, and I've had patients that even asked me this question as well: is hormone replacement dangerous or just kind of misunderstood? Because some people think like, oh, I can't take estrogen. I'm this age, or this is going to happen. So, let's talk about that and kind of how it's misunderstood too.
Absolutely. So back in 2001, there was a big study done on women with, they were trying to study hormone replacement. And this is one of the nurses study, the big longitudinal study that's being done out of Harvard. And basically what they did is they took these women and put them on hormones. And then there were a significant amount of people that had a stroke. Well, like everybody sounded the alarm. Everybody has to get off hormones. Hormones are bad for you. You can't take hormones. Everybody has a stroke risk. So that was like the big news back in 2001. Well, fast forward to 2012, and someone went back and did a review on that study. And basically, what they did is they took women that were over 65 years old and 10 years postmenopausal. So those women had not had any estrogen, any progesterone, anything for over 10 years. And estrogen's a blood thinner. It helps to thin the blood if we have it in our systems, and that's why women in general don't have as much. 10 years postmenopausally, you don't have any of those hormones to thin your blood. And what do you think is going to happen? You're going to create plaques in your arteries. And then all of a sudden, you start taking a blood thinner again, the estrogen, and you create an increased risk for stroke. And you have to take that data and look at it from kind of a different lens as well. You have to look at, okay, it's probably not safe 10 years postmenopausally to start a woman on hormones. So we don't do that anymore. We make sure that if they want to start hormones or if they want to consider doing something, that they do it as soon as possible after they stop having their menstruation. And we also do some other things to make sure that they're safe. We make sure that their cholesterol levels are in control. We make sure that their diet is supportive of good cholesterol levels because that can increase your risk of stroke as well. And then the other piece of that is knowing about your hormones and how they metabolize. And so we all have different propensities for our estrogen metabolism. And part of that is genetics, and part of that is kind of environmental as well. And the Dutch test is one of
Mhm.
the tests that tells us about the estrogen metabolism. And if we know we metabolize well and we're close enough to when our last cycle was, then hormones are not a risk. Because if they caused cancer, if they caused us to have a stroke, then all women would have strokes all the time. All women would have cancer because we make our own hormones all of our lives from the first time that we start our menstruation until we stop. We're making all kinds of hormones. And so if hormones caused these bad things, we would all have these bad things. And
Mhm.
if we know what our hormones are doing, if we know how we're metabolizing, if we know that how to be safe when giving hormones, then we're not putting ourselves at a different or increased risk. And the other thing is that you can't take one hormone without taking the other. So estrogen and progesterone offset each other. So they if you're taking them together or if you're making them in your body together in a balanced way, then there's not any difficulty. They have to be at a good ratio. When you have symptoms from PMS or if you have irregular cycles or anything with your menstruation, it's generally because your hormones are out of balance. Maybe one is too low, maybe one is too high, maybe they're both produced the same, but they're not metabolized well. And so, it's there can be risks of hormone balance even if you're not taking hormones. It can be from, your body not producing them in a good ratio or a good balance. So, hormones are not dangerous. Taking hormones is not dangerous if you're doing it in a really balanced, in a really educated and safe way.
Yeah, great answer for that too. I think that like solves kind of the mystery a lot of women have of how they associate taking hormones or later in life or when to start really and where there's a risk, where there's not too. And of course going back to the Dutch test and knowing your hormones and knowing your pathways too.
Exactly. Everything goes back to the Dutch test. Which is
And
not, this isn't an ad either. P.S.
no, but we'll touch on that a little bit at the end too of how we can open that up to our listeners and our program too, and how they can have access to that test to understand it more and read their
Absolutely.
own labs. So my last question before we jump into some rapid fire questions too is why does modern medicine still ignore perimenopause? So what do you kind of think about that and perimenopause?
It's it's because of the medical schools. It's because in medical school, you are not taught, even like we discussed earlier, even as an OBGYN, even if that's your specialty, we are not taught to manage hormones in menopause or perimenopause. You're just not taught that way. And it's not talked about as much. And I would venture to say in the past 5 years, it's being talked about a little bit more, but
Mhm.
still not something that is a, kind of a normal conversation that you have with your doctor. You might have that conversation with your girlfriends, um, but it's not something that is being taught. It's only something that those of us who want to really be able to help women, we're getting the education on how to help, on how to support, on how to treat. And I think that that's the real cause, is that it's just not being taught enough in medical
Mhm.
schools.
And when you go in for your yearly exam and you're a certain age, you're not getting asked those questions. They're not evaluating what's going on with you and discussing, what you could be going through at that time. So, yeah, it's just
No,
lack of information, especially in conventional medicine with your standard annual exam.
exactly. Which is sad because
Mhm.
women's hormones are complicated and they need to be talked about all the time so that we make sure that we can feel our best. Because if your hormones aren't balanced, you're not going to feel well. And you're going to kind of go through life with low energy or bad sleep or moods that, aren't the best, or, menstruation that takes you out for an entire week, or
Mhm.
whatever, of the 500 other symptoms that can be plaguing you every single day. They need to be talked about. Hormones
Right.
need to
Yeah.
be discussed because they affect so many areas of our health.
Mhm. Okay, so now I'm going to ask you some quick questions. And a good one to start with is, what's one thing you wish every woman knew about their body?
That you don't have to feel bad. You don't have to feel like you have bad health. You don't have to feel that way. You can feel good.
Okay. What's the most underrated sign that a woman's hormones are out of balance?
Not sleeping.
What's your favorite?
100%.
Yeah, that's a good one. So, what's your favorite herb for women's health?
Vitex, or chasteberry is the common name.
What functional lab do you think every woman should get at least once?
I think all the listeners will chime in to say the Dutch.
Okay, what is one natural remedy you always keep on hand for women's health?
Aloe vera.
What is one wellness practice you secretly don't love?
Taking a day out for self-care. Because P.S., we should do self-care all the time,
Mhm.
not just on one particular day
Mhm.
out of the month.
And what is one supplement you wish more women took?
Vitamin D.
Well done. Well done. So, so we're at the end of our interview right now, but I wanted to kind of discuss what we put together over this last year or two for our listeners, which you can find everyone on thecourse.health. So Kristi and I, we flew out to Greece last year and filmed an extensive online course. And it has within the course, besides offering live weekly classes, we do a standard 65 biomarker check at the beginning of the course and kind of walk you through different things every single week of this 12-week course, in which you can have lifetime access to. And Kristi is going to be teaching women's health during that one, and sexual health, and so many other great topics on there. And at the same time, you get access to all the labs that we use in our own clinical practice, including the Dutch test.
Yay.
And not to mention that you get access to the Dutch test, but you also get access to an entire interpretational video of Dr. Kristi going through that and discussing every single metabolite in it. So if you really want to take your health to a new level and to get to know your body and to get to know your hormones and every other pillar of health during this comprehensive course. It can be an amazing experience. So, Dr. Kristi, do you have anything else to talk about our course or
Well,
invite
one of
our
the things that we
listeners?
talked about, the elimination diet, is one of the modules. And so I will take you, you have the opportunity to do the functional test, the sensitivity test, if you want to. But included with the course is I think it's almost 200 pages of an ebook that
Hmm.
I wrote on elimination diet with hundreds of recipes and menu plans and grocery lists and just kind of a really comprehensive take on an elimination diet. So if that's something that you're interested in and don't know where to start, that's included in the course, which I think, is one of my very favorite things to do with patients because, like I said, it's one of the most effective things to do. Because if your digestion is working and you're eating the foods that allow your body to feel your best, you're automatically going to feel better. And so that one I really love. That module I love, but all of the modules, there's 12 modules or 13, I forget.
There's 12, and then there's a weight loss one too that we kind of touch on. So,
That's more of an
um,
ebook
yeah,
too. Okay.
exactly.
Yeah. But I mean, all of the videos, we've got hundreds of videos, and each module has its own videos and introductions and all kinds of educational information that you probably can't get all in one place anywhere else.
Right. And I think that's so powerful because it's not just a course where you sit down and watch videos and you have PDFs. And I mean, we have hundreds of videos. We have over 500 pages of PDFs, but we offer live weekly meetings and biomarker checks ahead of time. So, I mean, it has those two key components that really set it apart and have you learn more about your health and take control of it. So, it's a very interactive process too, where you're engaging and you're getting live feedback, which,
Absolutely. And it's not AI driven.
yep, yep.
Just personalized medicine from two doctors who have some experience.
Yes. A key component there. And you have the human portion there too. So, yeah, other AI and chat GPT and all those different things, you're not going to get the same information. You're going to get something more with soul and intuition and real guidance the whole way through.
Absolutely.
Okay, well, thank you so much for coming on today. And we'll be sure to give all of our listeners information on how to find you and your own clinical practice. And of course, our course as well. So everybody can choose to learn more about their bodies and join us for an awesome course as well. So thank you very much, Kristi.
Perfect. Thank you so much for having me on.
Okay.